South Coast Health has announced on August 29th of this year that they were going to close their maternity ward at the end of this year, that is December 31st. Since then, nurses, community have been rallying against that particular decision. With me today are mothers, nurses, and the former vice president of Massachusetts Nurses Association in the studio to talk about this, to talk not about the emotional side of this argument, but also the logical side about this argument. What is at risk? Welcome, everyone.
Thank you.
Thank you.
You are the former vice president, but you're still on the board of the Massachusetts Nurses Association. Could you please talk about the logical side of this debate, this argument? What is at stake here? What are they actually saying?
So, in all honesty, what's at stake is the safety of maternal and child health in the surrounding community of Wareham. So we have been seeing over the last several years these corporations that own community hospitals, for-profit or non-profit hospitals, closing essential services in our communities. That has ranged from the closure of an entire hospital, North Adams, to Quincy Medical Center, which was a large hospital that serviced, hundreds of thousands of people in the Quincy area, to psychiatric units out in Worcester, Burbank Hospital psychiatric units. They are proposing closing ICUs out in the western part of the state, along with psychiatric services. We are seeing it all over the state in all types of units, whether it be pediatric or maternal or psychiatric or medical surgical units. And this is a trend that we are standing up against and making the communities aware of, and trying to get something done that would provide some pushback and some power to the communities and the people that they serve related to the services that they should be receiving from the hospitals and from the corporations that own those hospitals. Because as it stands right now, those corporations hold all of the power, and there is no mechanism to stop the closure of these essential services. Right now we hold public hearings, but in the end they still close those units.
So we have heard from South Coast what they have stated as the reason behind the closure. They said that the birth at Tobey Hospital have been declining to 22%, and they are seeing about 300 and something birth each year. And so they feel that that is not the community's focus, and they are diverting their focus to the emergency care with the extension of the emergency room. Now, Joyce, you have been a nurse, and you're still a nurse there. You have worked at Tobey for very, very long time, about what?
24 years.
24 years. Mm-hmm. So could you tell us about the reality? What is actually taking place in Tobey?
At the hospital, well, care is as usual, exceptional. So we provide a service that's not good or not great, it's exceptional. Over the years, we have had the best outcomes in the state of Massachusetts. We have one of the lowest C-section rates in Massachusetts. Our breastfeeding initiation rates, our breastfeeding exclusivity rates, and these are all things that we get reimbursed from, that the Joint Commission recognizes, and they want hospitals to have these numbers. We do it. We have been doing it for years.
Speaking of care, I have Madison. Madison, you recently gave birth at Tobey Hospital.
2 weeks ago.
2 weeks ago. Yeah. So could you tell us, was that a conscientious decision, or you just ended up at Tobey because you couldn't predict it?
No, it was definitely a calculated choice. That's where we wanted to go. My sister and I, our mom was a nurse in the unit for about 10 years. So we were both born there. And so we knew as soon as, even before I was pregnant, I knew that's where I wanted to have my kids.
Okay, and what was your experience like?
It was fantastic. I was given every opportunity to to let things happen on my choice and my decisions. I wasn't forced into anything. I had an incredibly long and intense labor. I labored for about 40 hours before the baby started not tolerating the labor anymore. But even at that point, my husband and I were given the power to make the decisions for us and for our family. You know, it wasn't, you know, I feel like at other hospitals we maybe would have been pushed to deliver or have a section by the end of a certain shift or anything like that, but we weren't forced into any decision at all, which was incredibly powerful for us.
Okay. Now, Devin, you are an expected mother. Is this going to be your first time?
No, this is actually my third.
Okay, your third.
Yes.
Now, your first two children were delivered at Tobey?
Yes, they were.
Okay, so you decided that your third child is also going to be delivered.
That was my plan,
That was
yes,
the plan.
yes.
But because they're closing
Yes,
at the end of this year, you're not going to make the due date.
No, because she's due January 30th, so I'm going to miss the cutoff.
Okay, so tell us what that felt like.
It was really devastating. I remember Mom sat me down, I thought, to giving me the news, and I just started crying. I was so upset. And which I know is personal, and everything will work out. We have options, but it's just such a loss because I had such incredible experiences with my first two girls at Tobey. And like my sister Maddie said, I didn't just end up at Tobey. It was something, you know, we live in the area, but I've always wanted to deliver there, and I had such a good experience the first two times. And then also just knowing that I've grown so close to this team of women who work at Tobey Maternity and help me deliver my first two kids, and I watch them work with Maddie, that it's just hard to think I'm so ready for my third that I won't be with that same tight-knit group of women who I feel so close to.
Now, South Coast did say this. They said that they will be directing all of the inquiries to New Bedford, St. Luke's Hospital, where they are seeing about 1,500 babies yearly. But they're saying they're going to dedicate the entire maternity ward there for this particular change here. And they sent me a message. I asked them to be here today, but they sent me a message. In that message, a few lines, they said, "This decision was not taken lightly, knowing so many have treasured memories of starting or growing their families at Tobey. However, every decision we make at South Coast Health is driven by the needs of our patients and the community we serve." So do you feel they have done enough? Telling you to go to New Bedford, is that enough? And if not, why not?
I think it's fair, and we're not left with no options. As a community, like you said, you can go to New Bedford, you can go to Plymouth, there are options around here. But it doesn't seem, they presented it, I felt, particularly in that statement in August, that don't worry, you're going to have exactly what we had in Wareham. We're going to move everyone to New Bedford. And talking to some of the women at the maternity ward and providers, that that's not necessarily the case. It's not going to be this smooth transition where everyone's just going to pack it up and go. So knowing that I can go there, I'll be safe is nice, but it's not going to be the community that you've grown so close to and want to be with and feel comfortable around. So,
I mean, I'd just like to make a point too, is that while Devin and Maddie have the capability to be able to go to New Bedford for these services, they would rather go to Tobey because of the exceptional care that is given there. But we have a number of women who live in these communities who don't have the option of making those choices. They, don't have the ability to have the transportation or the means to get to a hospital outside of their community. And what we have seen when we have the closure of services such as this, which happened in Taunton at Wharton Hospital, when they closed the maternity services there, is that we have women who are presenting in the emergency room in acute crisis, because not everybody has an easy delivery. So when South Coast talks about, I think, what was it that you said, that they, every decision that they make is driven by the needs of the patients and the communities they serve, I would say, I would call and say, no, I don't believe so. I believe that corporation, every decision that they make is based on profit. And we should be doing everything possible to expand services at Tobey Hospital, it sounds like. So where they give such exceptional care and women come from all over to get that exceptional care. It's astounding. When she talked about the rates, the low cesarean section rates at her hospital, we had nurses in the audience at the DPH hearing who work in maternity units throughout the state who were astounded at that number. They wish that they were able to achieve that at their own hospital. So let's be clear, this was not driven by taking a look at the needs of the community. If it was, they would actually have been announcing an expansion of services and not the closure of services.
Okay, so they are expanding, in terms of expansion of services, they're expanding the emergency unit, as we talked about, because it feels that the need in our community in Wareham is geared mostly towards that. Let's talk about the numbers. They say the decline or childbirth, that's what is pushing this decision. Being on the board of Massachusetts Nurses Association, could you tell us what that means? I mean, how much money are they really losing to the point that they need to close this ward? Or is just there's another motivation behind this decision?
Okay, so it ends up being fairly complex. So a lot of times what we see is, first of all, there are trends with maternal and childbirth rates throughout the state. So we could be seeing, in particular, just a dip in the rate, but then it will go back up. So sometimes you take a look at the numbers, and that's the reason for the numbers. Another time is oftentimes these hospitals will make a calculated approach as to a closure of service. They will siphon off services and means for particular units because they'd like to close them and potentially expand elsewhere. It's about where they want to put their money. So what we saw as a trend is, for instance, I think some of the women that we have talked to have talked about VBACs, which is the ability to have vaginal birth after cesarean section. Those services were moved a number of years ago because you need to have an anesthesiologist on 24/7. No one has said that maternity services are cheap. They are not, because they require an array of services. So you need a pediatrician, you need an obstetrician, you need an anesthesiologist, you need nurses, you need OR capabilities, all of those types of things. But what we are seeing is that they will expand services elsewhere, which then siphons off services in another area, and then they get to then announce at some future point in time when they haven't replaced nurses who have left, or women have had to go elsewhere because they aren't capable to have a certain service at this particular hospital. Oh, well, the numbers are low now. But
so you're saying these numbers are staged?
I would say that they are probably skewed because, let's face it, they did expand services at St. Luke's, and I would say it was a calculated decision on South Coast to move the services at Tobey Hospital over to St. Luke's. Which I think is something that we have been seeing throughout the state. And they have the capabilities to do it. And then they come out and they say, well, the numbers are low. And the thing is, these women, when they give birth at their community hospital, they then bring in their families for care at that hospital. So it is more than just giving birth to your child at a particular hospital. It is about the entire family who lives in that community, who then take advantage of all the services that hospital offers as in the future.
Hello, my name's Andrea Fonseca. Just to give you a little background about myself, I am a nurse. I actually work at Brigham and Women's. I live in New Bedford, so born and raised in this area. We have good ties to Wareham, familial ties. I had my first daughter at Tobey. I would have had my second daughter there, except I did have a successful VBAC, but I was forced to have that VBAC at St. Luke's. Something that really struck a chord with me throughout this is, you know, the fact, and this is countrywide, this is not just here in Massachusetts or here in Wareham, all over this country, the reimbursement rates for maternity care is so low. The reimbursement rate for vaginal delivery is about half of what it costs a hospital. So I know there are real financial issues on the hospital side. I agree community hospitals, no matter what, need to service their community. But why is it that this country doesn't value women's health? Why is the reimbursement rate so low? You know, I really think that if we're really going to change this, I mean, this is a ripple effect going on everywhere, especially in the rural part of this country. It's awful. But until we really get the people with money and power to value women's health care, to value women, this is going to keep happening no matter where it is. And I'm not sure what we can do about that. I think this is a place to start. This is one little piece of this puzzle. But this is a huge puzzle. And the puzzle is going to keep being dismantled if we don't stand up for ourselves as women and get other people to value us as women. That was the biggest thing that I really discovered during all this.
So could we talk about the power of the state? During last hearing in Wareham, Department of Public Health was there to facilitate the hearing. What power do they have in this? What do they get to say?
So the Department of Public Health, anytime a corporation who owns a hospital announces a closure of a service, they are obligated to provide notice to the Department of Public Health, who will then hold a public hearing to hear from the stakeholders, which is the patients in that particular community related to the services. They will then deem whether or not that is an essential service that is needed for the community. And what we have found is that Department of Public Health, they will deem a service as essential to the healthcare needs of that particular community. And in the end, the hospital corporations then turn around and they say, thank you very much, DPH, and we're still closing because they can.
And what power does the Massachusetts Nurses Association have?
So we have filed legislation at the State House. It is called the, basically it's an essential services bill, which would require hospitals, it would require, as opposed to, I believe it's a 90-day notice from we are closing to when they have the capabilities to close. It would expand the amount of time that that they would have, so up to a year, I believe it is now. Not only that, but DPH would have the ability to, yes, hold hearings, but that hospital would be limited to the expansion of services while they were in this period. Because that is what we have been seeing. They announce closure here and they expand services elsewhere. So it's a good bill, and I think people should take a look at it, and I think it's something that's comprehensive and will actually put some teeth into what the community citizens of Massachusetts can expect.
Have you explored any compromises with South Coast? Have you sat down with them and say, I get it, you're losing money, or this is not a lucrative part of the business, the service is still very essential to the community, how about we do this?
What would you say to that, Joyce? I mean, how do you compromise on women and children's health? How do you compromise on the safety of patients? How do you compromise on
the available care in the community where women can't get to another hospital?
So when we are talking about the need of those who do not have the means to make the journey to New Bedford from Wareham, a 20-minute journey to Wareham for any means, how do you defend that we need to include them in this decision and we need to think of them in this decision?
So what I would say is that hospitals are obligated to take care of all patients. We don't put our patients into categories related to socioeconomic status or gender or or any category, a patient is a patient, and they are obligated to provide care to everyone. Bottom line.
We also, there are patients in the community of Wareham that choose to go to Boston for whatever reason. It could be that's where they choose to deliver. It could be that maybe they're a high-risk pregnancy that they need to go to Boston, and for some reason they can't get there. And so they show up at Tobey. We have to provide care. We have to stabilize them, and sometimes we can't stabilize them enough to transfer them to the facility that they needed to go to, and we have to deliver them. We have to be ready, prepared, and have the knowledge to take care of them, stabilize them, healthy, and then transfer if we have to. So if this service is not here providing service to patients that maybe can't get to Tobey or get to St. Luke's or even get to the hospital that they're supposed to deliver at, they need a place to have a safe delivery, and that they don't only need it, they deserve it.
Could you tell us about your experience, Devon, when was it your first or your second?
My first.
Your first, and you chose to be here in Wareham, or
Yeah, I did. I chose to be here.
you
in
chose to
Wareham.
be here in Wareham, but the baby was coming way too fast. And
She came very fast,
Okay.
yes. So even though I have a car, I had transportation, and I know New Bedford isn't that far of a ride, but I had her within minutes of arriving at Tobey. So if I had been driving to New Bedford, it's highly likely I would have had her in the car. So it's just so essential to have this service in local communities where people are expanding their families, and to have a service at the community hospital, because that's our community. People are having children, and sometimes things don't go according to plan, or babies decide to come pretty fast. And
We don't know. We don't plan.
No.
We don't tell when they're coming. We don't know when they're coming. If we knew that, we wouldn't be here, right? Babies come when they come. They come out how they come out.
so when Tobey is expanding the emergency center to accommodate the trend in our community, for those who feel that since we are going to have a well-equipped emergency room, for those unplanned, untiming birth, they can just be directed to the emergency room. Tell us why this is not a good decision.
The emergency room provides great care to their emergency patients. The skill to be able to take care of a mom and a baby that's going to be delivered safely is not something that they're trained in. It takes it takes years to develop the feeling confident and taking very good care of these moms. They're not going to come into the emergency room, and maybe there's going to be a mom who presents and she has a breech baby. For those of you that don't understand, that this baby is presenting either feet or buttocks and not head. Typically that's an emergency, and then they would need to have an operative delivery. And if it's not safe to transfer that patient, someone's going to have to do that delivery. Who's going to do it?
And the emergency room is not equipped for something like this.
They don't have the skill or the knowledge.
And not having the skill or the knowledge means someone's life. And in this case, 2 lives.
Correct.
Exactly.
Okay. So where are we? Today we had a rally. Where are we? How optimistic are you in this fight? Is the point getting across, and do you think Tobey is going to make the right decision?
I don't know if Tobey will make the right decision. They have the ability to make the right decision. And I think we, at the very least, are bringing more of an awareness to the citizens of Massachusetts that these corporations need to truly provide an entire spectrum of services to the communities that they serve, because that is what a hospital does.
What can our community do to help, to aid you in this fight?
I think they need to make calls. They need to make calls not only to their legislators, but they need to make calls to Keith Hovan, who is the CEO of South Coast Hospital System, and let them know that this is a poor decision, and that they don't agree with it, and that I think the community needs to fight back. They need to stand up and they need to fight back. we're going to do everything possible to continue the fight.
Well, thank you everybody for being here this morning to give us a little light about this situation and to explain things into details for us to understand what is at risk here. And I'm sorry that you will not, maybe things will change.
Maybe.
So to my viewers, thank you so much for being with us. Joining us in this discussion, I had Joyce Heisley Pikella.
Thank you.
Oh my goodness, she is she's still a nurse at Tobey Hospital. She's been there for 24 years, so you have to pay attention to what she says. And also Karen Coughlin, she was the vice president of Massachusetts Nurses Association. She's still on the board. So
And still a nurse.
still a nurse. Okay.
And still a nurse.
And we had Devin Jamora. Okay, and she's an expected mother who, depending on what the decision will be, she may or may not be delivering her child as she planned at Tobey. And last but not least, Madison Smith, who just delivered a couple weeks ago?
2 weeks ago.
2
yeah.
weeks ago,
Thank
congratulations. And she had a great experience at Tobey, and she wishes that for every single family, for every single woman. So thank you. There's plenty to understand here, to listen to, and as you have heard from Karen, that you can join in the fight through calling those responsible. Make sure that they understand this is something not to be taken lightly and you are paying attention. I am Queen Banda of WCTV, and I wish you all a lovely day.